Infectious Diseases, Preventive Medicine and Clinical Conferences Concerning Species 3, 2024-2025. Diseases of small ruminants, Caprine arthritis-encephalitis, Ovine pulmonary adenomatosis, Visna-Maedi, Rotavirus diarrhea in goats, PESTE des petits ruminants, infection with small ruminant morbillivirus, Caprine arthritis-encephalitis sieve. Contagious infectious disease caused by a lentivirus included in the small ruminant lentivirus serogroup, manifested clinically in young animals, by a progressive paralysis associated with leukoencephalomyelitis, and in adults with polysynovitis and arthritis. Economic and medical impact. Significant economic losses on dairy goat farms. Virus not pathogenic for humans, but causes the synthesis of specific antibodies. The immune response interferes with that of the human immunodeficiency virus, HIV, and there is a hypothesis that false positive reactions to HIV are due to this consumption of goat's milk infected with sieve. Cross-reaction occurs with the glycoprotein antigens on the surface of both lentiviruses, sieve and HIV. Etiology: Caprine arthritis-encephalitis virus, CAEV. Family Retroviridae. Subfamily Orthoretrovirinae, genus Lentivirus, serogroup of small ruminant lentogenic viruses, SRLV. Morphology. Morphologically similar to MEDI Visna-virus and human immunodeficiency virus HIV virions, spherical particles, enveloped and with numerous glycoprotein peaks, GP120, GP41, on the surface. Viral matrix, P17, ball-shaped capsid, P24. 3 enzymes involved in viral replication, reverse transcriptase, integrase and protease. 2 identical single-stranded RNA strands. 9 genes. GAG, POL and ENV, have the genetic information necessary to synthesize structural proteins for new viral particles. TAT, REV, NEF, VIV, VPR and FPU encode proteins involved in the control of the infectious power of the virus, the production of new viral copies, or the production of the disease. At each end, the RNA strands have a long repetitive end sequence that helps in viral replication. Etiology. Caprine arthritis-encephalitis virus, CAEV, has several distinct genetic isolates whose virulence is variable and is linked to the ovine MEDI Visna-virus, VMV. Sieve and VMV are small ruminant lentiviruses, PRLV. Phylogenetic studies, based on the analysis of short nucleotide fragments. 6 RNA subtypes marked from 1 to 6. Subtype 1, MEDI prototype strain of Icelandic mahogany and related strains of MVV. Subtype 2, North American lentiviral strains. Subtype 3, Norwegian lentiviral strains. Subtype 4, French lentiviral strains. Subtype 5, French and Swiss sieve strains, North American prototype strains and North American ovine lentiviral strains. Subtype 6, Swiss lentiviral strains. Phylogenetic studies based on the analysis of long nucleotide fragments. Will describe 4 groups, rated from A to D. Group A with 7 subtypes. Subtypes A1 and A2 only include sheep isolated. Subtypes A3, A4, A6 include sheep isolated and goats. Group B has 2 subtypes. Subtypes B1 and B2 include lentiviruses isolated from both sheep and goats. Group C and D include only lentiviruses isolated from goats. Genetic recombination between the MEDI Visna viruses of Group A and the Caprine arthritis-encephalitis viruses of Group B is possible, when they simultaneously infect goats. Biological characteristics. Sieve. Host specificity, tropism for macrophages, causes persistent infections in monocytes and macrophages, marked neurotropism, in young people acute, in adults chronic. Viral replication is intense on cell cultures, where it produces syncytia. Strategies of sieve to avoid immune response. Sequestration of epitopes for neutralization, low titers of neutralizing antibodies, induction, antigen drift during persistent infection. C forms syncytia and is not cytopathic. MEDI Visna generally produces syncytia and cytopathic EST. Sensitivity destroyed. Lipid solvents, iodine derivatives, phenolic disinfectants, formaldehyde and pH less than 4.2. Phenolic compounds and quaternary ammonium derivatives recommended for routine decontamination. Pathogenesis. The infection is produced by consumption of colostrum or milk with infected macrophages. Infected cells pass through the intestine intact and enter the reticuloendothelial system, producing an infection of the gout. Infected monocytes reach target tissues, synovial, pulmonary, interstitial, choroid plexus and breast, producing characteristic lymphoproliferative lesions. Epidemiology. Receptive species, goats, maximum sensitivity at 2 to 6 months in dairy breeds. Contamination. Digestive by consuming contaminated colostrum or milk, the main route of transmission. Cohabitation, direct contact with infected animals. Venereal, limited role in the spread of the disease. Epidemiological dynamics and zootics. Clinical, 5 forms, named after clinico-injury manifestations. Joint, most common, in adults, mammary, pulmonary, progressive interstitial pneumonia, nervous, leukoencephalomyelitis, cahectizing. Goats can remain infected clinically, 80%, or develop one or more of the 5 forms, 20%. Clinical. Articular. Described in adults, sexually mature animals. Insidious or acute onset. The clinical course varies from one individual to another. All joints of the limbs and the atlo-occipital bursa can be affected. Most commonly described in the carpal joints, tarsus, atlo-occipital bursa and finally, the coxofemoral joint. One or more joints may be involved. The first signs of arthritis may be subtle, normal-appearing joints, decreased locomotor and eating activity, reluctance or difficulty to lift, weight loss. Sometimes, fluid can accumulate in the carpal bursa, causing acute and obvious swelling of the joint, with a consequent decrease in mobility. Swelling 10 cm diameter, soft, cold, painless. Fluid may be drained, but it will recover. Persistence for months or years, or cycles of swelling, eventually painful and spontaneous recovery. Progressive evolution with disabling and painful osteoarthritis. Weight loss and dull hair. Animal with fever, initially soft, then firm swelling of the joint bursa with inflammation and thickening of the joint capsule and adjacent structures, and reluctant to use the affected limb. Progressive mineralization of the joint capsule and soft tissues gives rise to exostosis, which is painful. Limitation of locomotion capacity with ankylosis. Carpal location is expressed clinically with partially flexed limb and severe and permanent flexion. When both limbs are affected, the animals lean on the forearm. Neural form, are more common in goats from 1 to 6 months, milk lines. Less common in goats over 6 months old. Slow and progressive development, weeks. Paresia and progressive paralysis of the limbs, mainly suggesting damage to the spinal cord. Frequently in the rear end. Initially, flexions of the carpal or tarsal joints and altered lead are observed when stationary and uncoordinated in movement, particularly on the hindquarters. Gradually, the animal may show difficulty in lifting and subsequently the inability to get up when going to lie. Neural form 2. In the early stages of the disease, many goats remain active and continue to eat and drink despite having locomotory difficulties. Death frequently occurs as a result of pneumonia. Healing is rare. Other clinical signs: depression, blindness, abnormal pupillary response, nystagmus opisthotonus, head tremor, head tilt, torticollis, walked in a circle, facial nerve deficiencies, dysphagia, increase in body temperature. Respiratory form as progressive retroviral interstitial pneumonia. Clinical evolution: chronic dyspnea. Intolerance to movement exercise, associated with swelling of the carpal region. Secondary bacterial co-infections where antibiotic therapy is temporarily effective. The radiological examination: in the early stages of the disease, small clusters of interstitial pneumonia. As the disease progresses, extensive areas of lung consolidation and bullous emphysema. The diaphragmatic or craniolateral lobes are frequently affected. Mammary form retroviral mastitis or hard udder, I, most often expressed at calving. Mammary gland is firm, almost a block of stone, non-erythematous and non-adematous. Local temperature not changed. Milk is expelled with difficulty and in small quantities, with a normal appearance, but with increased number of cells. Mammary form retroviral mastitis or hard udder 2. The disease grows locally, without systemic manifestations after several weeks of evolution. In certain specimens, milk production resumes, which gives a false impression of therapeutic success. In other animals, induration of the entire breast gland or only the affected half of the gland persists. The lymphatic nodes belonging to the hind limbs are enlarged. In subsequent lactations, the clinical signs may be less severe, and the number of cells in the milk smaller, and the endurance of the mammary gland is lower than in the first lactation post-infection. Cachetizing form. Progressive weight loss may be the only clinical manifestation, or may be associated with one of the clinical forms presented above, most often joint and pulmonary forms. Clinical and paraclinical investigations, joint shape arthrocentesis and examination of synovial fluid, red, cherry, low viscosity synovial fluid. Increased cellularity, 90% mononuclear cells, lymphocytes, macrophages and synovial cells. Synovial biopsy, pathological, viral cultures by explantation techniques, PCR, particularly useful when serological tests are negative. Radiological examination, distension of the bursa with fluid and swelling of the periarticular tissues, calcification of the joint capsule, adjacent tendons, tendon sheaths, ligaments and joint contents, moderate periosteal reaction and periarticular osteophytes, rupture of subchondral bone tissue, collapse of the joint space, ankylosis. Nerve form, examination of cerebrospinal fluid, total protein and blood leukocytes slightly increased. Increased cellularity due to lymphocytes and monocytes, and less often neutrophil growth. Anatomopathological macroscopic, shape of the joint housing emaciated, thickening of the joint capsule and marked proliferation of synovial villi. Synovial membrane is brown, velvety and with digitiform projections into the synovial cavity. Sources of mineralization, necrosis and fibrous scar tissue, in the tendons and periarticular. Cartilaginous surfaces may be rough, ulcerated or eroded. Whitish deposits of rice grains in the joint cavities, tendon sheaths and bursae. Ankylosis, and collapse of subchondral bone tissue. Severe forms, severe destruction of cartilage, rupture of ligaments and tendons, and formation of periarticular osteophytes. Chronic forms, calcification of the joint capsule, tendon sheaths and articular bursae. Nervous form, Visna-type lesions, pink-brown swollen areas, most often in the cervical and lumbosacral segments of the spinal cord. White cloud-like spots in the meninges. Brown areas in the white matter of the brain, spinal cord, and on ventricular surfaces. Swelling of the spinal cord, microscopic in adults with joint form, hyperplasia of synovial cells. Subsynovial mononucleate cell infiltrate, lymphocytes, macrophages and plasma cells and sometimes polymorphonucleates. Same type of mononuclear infiltrate is found in the mammary gland, lungs, uterus and kidneys. Villous hypertrophy. Synovial edema, with fibrin deposits, on the synovial surface. Synovial necrosis and mineralization of synovial, perisynovial and tendon collagen. Goat's nervous form. Multifocal mononuclear inflammatory leukoencephalomyelitis, in cervical and lumbosacral segments, visible lesions of leptomeningitis. Inflammatory foci with mononuclear, inflammatory response is mainly perivascular and consists of aggregates of lymphocytes, macrophages and plasma cells. Inflammatory areas are surrounded by areas intensely populated with astrocytes and microglia, marked demyelination of axons adjacent to the inflammatory process, destruction of axons, malacia of intensely demyelinated areas. Brain lesions are described in more than 60% of cases, located periventricular and periapoductal, extending into the white matter along the vessels. In severe cases, lesions can be found in adjacent gray matter. Lymphocytic infiltration of the meninges and choroid plexus is frequently observed. Goats with chronic interstitial pneumonia, infiltrate of mononucleate cells, in the alveolar septa, and perivascular and peribronchial regions. Goats with progressive pneumonia, interstitial, peribronchiolar, accumulations of mononuclear cells. Proliferation of type 2 pneumocytes. The pulmonary alveoli are filled with eosinophilic material similar to surfactants. In females with hardened udder, mononuclear infiltrate in the periductile stroma, which obliterates normal mammary tissue. Cellular infiltrations can compress the milk ducts towards the outside or penetrate them, stopping the passage of milk. Possible lobular atrophy and starchy bodies. Sieve proliferation of the synovial membrane, pannus, extensive formation of osteophytes, floating concretions, rice bodies or joint mice, degenerative joint disease with destruction of subchondral bone, ulceration and erosion of articular cartilages, and mineralization of the tissues surrounding the joint can be observed. Goat, carpal joint. Marked proliferative synovitis and cartilage erosion. Synovial membrane of a goat affected by Caprine arthritis-encephalitis, subsynovial infiltration of mononuclear cells and presence of lymphoid follicles. Swollen cranioventral lung lobes in a goat with Caprine arthritis-encephalitis. Cross-section of the brain of a goat with Caprine arthritis-encephalitis. Coagulant necrosis is present. Section of the brain of a goat suffering from Caprine arthritis-encephalitis. Perivascular mononuclear cell infiltrates are present. Confirmation diagnosis. Isolation of the pathogen, viral nucleic acid detection, antigen detection, demonstration of immunological restructuring. Sieve-1 diagnostic method, AGID-PS, positive serum, AG, antigen, 1, serum sample positive, 2, serum sample weakly positive, 3, serum sample negative. Sieve-2 diagnostic method, syncytium assay. Cells infected with the Chi virus form a multinucleated giant cell. Confirmation diagnosis. Isolation and identification of the causal agent. In live animals, isolation of sieve from leukocytes of peripheral blood, milk, and synovial fluid. Culture of leukocytes extracted from peripheral blood or milk with cells from the goat synovial membrane, GSM. GSM cell cultures are good as indicator cells. If a cytopathogenic effect is suspected, viral antigen screening tests. PCR of peripheral blood monocytes, PMBC, should be performed. 1 in a million leukocytes contains the virus. The PCR technique may not detect the virus because the viral load is below the detection limit of the reaction. To increase viral load, it is possible to co-cultivate PMBCs with fibroblasts. PCR appears less sensitive than ELISA. Sometimes infected goats were identified by PCR before seroconversion and without the need for co-culture. In addition to PBMCs, the PCR technique has also been applied to other types of biological sample, semen, milk, synovial fluid, obtaining similar results to peripheral blood samples. Confirmation diagnosis. Immunological diagnosis. Agar gel immunodiffusion test, AGID, and ELISA technique are considered good enough for sieve control programs. The interpretation of a positive serological result is done with caution. Many factors are involved in the etiology of arthritis, pneumonia, and mastitis in goats. Most animals with sieve have subclinical infections with a positive serological result does not necessarily imply swollen joints, respiratory signs, or mammary gland disease are exclusively the result of sieve infection. Control programs based on the identification and slaughter of seropositive animals. The kids are separated from the infected mothers and receive virus-free colostrum and milk. Goats are isolated from birth. Feeding is done with heat-treated colostrum and pasteurized milk. Control programs based on seropositive and seronegative segregation. Groups are separated in enclosures at a distance of at least 2 meters. The material common to both batches is decontaminated with phenolic compounds or quaternary ammonium derivatives. Seropositive goats are milked at the end, and the milk or whey is heat-treated before being fed to the kids. Periodic serological tests of females or the entire herd, 1 to 2 times/year. Control of arthritis due to encephalitis in goats by breeding virus-free goats, non-exposure of young goats to the virus. Avoid ingestion of milk or colostrum from infected goats. Separate young goats from their mothers immediately after calving. Risk of infection if licked or washed by infected mothers. Goat hygiene, rapid elimination of fetal fluids. Induce labor with prostaglandins on day 144 of gestation. Move young goats to other shelters, separate from adults. Feeding with heat-treated goat colostrum. Provide passive immunity for other neonatal diseases without being exposed to SIV. Heat treatment, 60 minutes at 56.0 C blocks the transmission of the virus and allows the absorption of immunoglobulins. Alternative, heat the colostrum to 57.0 C for 10 minutes, transfer it to a thermos that has been heated with pre-boiled water where it is kept for 60 minutes to inactivate the virus. Excess colostrum can be frozen and used later. Subsequent feeding with pasteurized goat's milk, cow's milk or milk substitutes. Goat's milk can be pasteurized by heating to 73.90 C for 15 seconds. Control of caprine encephalitis by periodic serological tests, determination of prevalence in infected farms. Separation into infected and non-infected groups, or identification of positives for culling. Evaluation of the effectiveness of control programs, reprocessing of negatives. There is no generally valid rule for the frequency of serological tests, which is influenced by initial level of infection in the herd size. Operations management ability to implement control strategies. Monitoring programs recommend monthly testing of goats during the first 6 months, because post-infection perinatal seroconversion occurs after a variable period of time. Attention! Feeding heat-treated goat colostrum leads to false positive serological results in the first months of life. Adult goats should be tested at least once a year, and preferably twice a year. The sensitivity of serological tests is not 100%. Serum antibody titer may be reduced in some females. In late stages of pregnancy, serum antibody levels may be reduced due to maternal transfer of antibodies from serum to colostrum. Serological testing of the entire herd is carried out at the start of the breeding season. The results obtained can be used to make decisions regarding breeding, slaughter and the application of SIV control measures before the start of the breeding season. Calving, control of caprine encephalitis arthritis by slaughter or separation. Identification and culling of SIV-positive adults, the best method to eliminate the risk of horizontal transmission. Identification and separation of seropositive adult subdivision of goats, a group of SIV-positive people, a group of SIV-negative people. Physical separation at a greater distance, ideal in buildings with solid walls, which do not allow direct contact of individuals from both groups. Separate equipment and materials for the two groups if it is not possible to completely separate the operating flows of the two batches. Feeders, waterers and other care items should be used first in SIV-negative animals, and after use in SIV-positive animals, they should be washed and decontaminated. SIV-negative people are treated first, then SIV-positive people. Avoid contamination of surfaces, clothing and equipment with milk from SIV-positive goats. They are not going to bring back goats from fairs and exhibitions. Goats are purchased only from certified SIV-free herds or quarantined for 6 months and serologically tested with a negative SIV result. Only SIV-negative goats are used for reproduction. If this is not possible, the insemination will be carried out under the responsibility of the owner, the goat being removed immediately after the insemination. Disposable needles and syringes are used for treatment or vaccination because iatrogenic transmission is at least theoretically possible. The virus is present in peripheral blood monocytes. Decontamination of identification instruments with phenolic compounds or quaternary ammonium derivatives. Avoid keeping sheep and goats in the same shelters. There is a risk of cross-species transmission of small ruminant lentiviruses, and this could have a negative effect on SIV control programs. Pulmonary adenomatosis, also called pulmonary adenocarcinoma, is a contagious tumor of the respiratory epithelium. After an often long incubation period, it manifests itself as cachectic respiratory disorders of progressive and chronic development. This viral disease is also known as juxeect, in Afrikaans, which means shortness of breath. It resembles a particular form of human cancer, bronchioloalveolar cancer, because it presents clinical, macroscopic and histological similarities. Anecdotally, the sheep dolly, the first mammal cloned from adult cells, suffered from pulmonary adenomatosis and had to be euthanized in 2003. Etiology. It has long been difficult to determine the viral agent responsible for pulmonary adenomatosis. A herpes virus was initially suspected, but studies ultimately showed that it was undoubtedly a type B retrovirus. It belongs to the genus Beta-retrovirus and is called Yorkshire sheep retrovirus, JSRV, recalling that the disease was first recognized in South Africa in 1915. This virus is very close to another retrovirus responsible for enzootic nasal tumors in small ruminants. Pathogenesis. After inhalation of the virus and infection of the alveolar and bronchiolar secretory epithelial cells, we will see expression of JSRV envelope protein and activation of proliferation and malignancy of cells infected with malignant secretory epithelial cell proliferation and excess lung fluid. Progression of adenocarcinoma. From a single row of cells, tumors can reach 10 to 15 centimeters in diameter. Progression can take from a few months to several years. Most infected animals do not show clinical signs, but clear the virus. Clinical signs are only observed when the size of the tumors is large enough to compromise lung function. Large tumors may have necrosis or central fibrosis, pathogenesis. The retrovirus is present in tumors and pulmonary secretions. It is transmitted by close and prolonged contact via virulent aerosols and travels through the respiratory tract. Field observations show that overpopulation and poor environmental conditions are contributing factors. JSRV induces the transformation of differentiated pulmonary epithelial cells. Type II pneumocytes in the alveoli and Clara cells in the bronchioles. Proviral DNA is also detected in lymphoid tissues, alveolar macrophages and blood mononuclear cells, but only type II pneumocytes and Clara cells support active virus multiplication. The tumors are therefore observed in a single organ, the lung, and in the two cell types mentioned. Symptoms appear in adult age, when the accumulation of tumor areas deteriorates respiratory function. As type II pneumocytes secrete and store alveolar surfactant, their multiplication increases the secretion of abundant clear and mucosal fluid into the airways. Epidemiological characteristics. Sensitive animals. Young lambs are most susceptible to infection, but this susceptibility gradually decreases until 6 months of age. The immaturity of the immune system and the abundance of cells sensitive to the virus in young people could explain this finding. The incubation period is long, lasting between several months and several years. Animals that express clinical signs are adult animals aged 2 to 5 years. Epidemiological situation and risk factors. Pulmonary adenomatosis is worldwide distribution, with the exception of Iceland, which has eradicated it, Australia and New Zealand. In Scotland, lesions were observed in 20% of the lungs of sheep aged over 1 year, while mortality losses were 2 to 10% per year. The importance of the disease is difficult to assess, in particular because of a diagnostic lack of knowledge. Pulmonary adenomatosis is recognized in the EU and France but not evaluated. Cases have been diagnosed on several occasions in Munch and Basco-Béarnais ewes coming from the Basque Country, Béarn, and in Lacona ewes coming from the Roquefort Basin. No relationship could be established between racial, sexual, individual factors and the frequency of the disease. Epidemiological characteristics. Mode of transmission and limitation of losses. The appearance of the disease often follows the introduction of breedings. Commercial trade contributes to the dissemination of the disease. Transmission between sheep surely occurs through the air when coughing or when fluid is released. Other routes of contamination, such as passage in utero, parturition or milk, cannot be ruled out. In affected flocks, economic losses are limited by the anticipation of sick sheep and mortalities, symptoms and progress. Pulmonary adenomatosis is revealed clinically in adult sheep. Signs appear when the volume of tumors becomes large enough to interfere with lung functions. Respiratory distress occurs when the lesions are well established. The first sign to appear is shortness of breath after forced exercise. This shortness of breath then manifests itself at rest. The animal has dilated nostrils and open mouth in polypnea. A wet cough can be added to the clinical picture with abundant nasal discharge of clear and viscous liquid. This mucus is sometimes sufficiently abundant to flow through the nostrils when the animal's head is lower than the thorax. If you hang the ewe by its hindquarters, you can sometimes collect up to 200 milliliters of this liquid. This sign, called the wheelbarrow test, although inconsistent, is very suggestive of the disease. Lung auscultation reveals crackles due to this mucus, which adds to the reinforcement of normal breathing sounds. These groans are sometimes so intense that they can be heard without a stethoscope. The animal loses its appetite and loses weight. The course of the disease is apyretic and lasts 6 weeks to 6 months. It is often interrupted by an infectious or parasitic process. Whether the ewe dies or is culled, the lesions must be identified to confirm the diagnosis. Mucus is sometimes abundant enough to flow through the nostrils when the animal's head is lower than the thorax. This sign, called the wheelbarrow test, although inconsistent, is very suggestive of the disease. Lesions. It is often difficult to distinguish pulmonary adenomatosis from terminal meaty Visna. The use of a histopathological examination is mandatory. The pathognomonic sign is the accumulation of clear and viscous liquid in the respiratory tract. At autopsy, the lung must be examined. It is often doubled in size. The imprint of the ribs is then clearly visible, and its weight is 3 to 5 times higher than normal, reaching between 1.2 and 1.8 kilograms. Early lesions are white nodules of 1 to 30 mm which extend into the cranioventral region. The miliary appearance of these lesions makes it possible to distinguish adenomatosis from meaty Visna. On histopathological examination, the lesions are bronchialo-alveolar adenocarcinoma type. Necropsic examinations, lesions solid, gray and granular surface from which a foamy liquid frequently escapes. Histopathological lesions, non-encapsulated neoplastic foci, with malignant cells, type 2 alveolar epithelial cells, 82%, Clara's bronchial secretory cells, 7%, undifferentiated cells, 11%. In areas of increased malignancy, cellular pleomorphism of many cells in mitosis. Disseminated necrotic foci, nodules of free mesenchymal tissue. Diagnosis. Clinical examination of the patient generally makes it possible to locate respiratory disorders in the lung and therefore to eliminate conditions of the nasal cavities causing discharge such as pituitary adenoma or estrosis. The wheelbarrow test is also a very telling sign. The clinical diagnosis must be completed by necropsic and histopathological examinations after an autopsy of the affected animal. Lesions may be found in animals without clinical signs. Histopathological examination then becomes essential to confirm the diagnosis of pulmonary adenocarcinoma. There is no humoral response to the retrovirus, which prevents the development of a serological test for diagnosis. Differential diagnosis of pulmonary adenomatosis is carried out with wasting diseases with respiratory disorders. Meaty Visna, atypical pneumonia, chronic suppurative pneumonia, diffuse pulmonary strongylosis. Prophylaxis. No vaccine is available at this time. Prophylaxis is essentially health-related. Free herds. The introduction of affected animals must be avoided by controlling cellars, by inspecting lungs at the slaughterhouse and inspecting animals aged 2 to 5 years. Infected herds. The affected animals and their descendants must be eliminated. Conclusion. Pulmonary adenomatosis is a contagious disease caused by a retrovirus. It is characterized by a long incubation period, damage to a single organ, lung, and a chronic, inexorably fatal course. The diagnosis is based on histopathological examination, and there is no treatment. Prophylaxis is sanitary and is based on permanent monitoring of the entire herd. Visna-Maedi MVV, it has various names linked to the clinical, anatomopathological lesions and dynamics. Progressive pneumonia in sheep, chronic progressive pneumonia, chronic encephalomyelitis, infecto-contagious disease of sheep, and not so frequent of goats, caused by a lentivirus of small ruminants, which develops in a chronic respiratory or nervous manner, with lesions of the joints and the mammary gland. Maedi, dominant clinical respiratory lesion, progressive sheep pneumonia. Visna, dominant clinico-lesional by nervous signs, chronic encephalomyelitis, arthritis and chronic mastitis. Economic and health impact. It negatively affects animal production and welfare. The economic impact depends on the breed, farming system and type of production of the animals. It's not a zoonosis. The close link between small ruminant lentiviruses and HIV has stimulated research into MVV and SIV. Diseases caused by MVV and SIV have served as a study model for HIV/AIDS. Etiology: Maedi Visna-Virus, MVV, family Retroviridae, subfamily Orthoretrovirinae, genus Lentivirus, small ruminant lentogenic virus, SRLV, serogroup. Persistent infections that manifest clinically slowly, gradually. Lentiviruses are classified into 5 serogroups, corresponding to the hosts with which they are associated. MVV and SIV are included in the small ruminant lentogenic virus serogroup, produce Maedi Visna in sheep, and Caprine encephalitis in goats. Cattle associated with bovine immunodeficiency. Equine associated with equine infectious anemia. Feline associated with feline immunodeficiency. Primate containing simian immunodeficiency virus. And human immunodeficiency virus. Biological characteristics. Persists throughout the life of the animal, in monocytes and macrophages. Has a variable pre-immune period, from infection to evidence of immunological restructuring. Resistance/sensitivity. Lasts several days in the environment, especially in hot and dry conditions. Destroyed by usual disinfectants including lipid solvents, hardened derivatives, phenolic disinfectants, formic aldehyde and low acid pH, pH less than 4.2. Maedi Visna virus replicates via proviral intermediate DNA copies of its RNA genome in circulating monocytes, in which replication is highly restricted, and in tissue macrophages, where viral genome expression is more obvious. The presence of macrophages expressing viral antigens on their surface in the lungs, udder, joints, or central nervous system tissues provides a focus for a local inflammatory response of mononuclear cells. Immune activation in Maedi Visna-mediated injury. Differentiated macrophages allow continuous presentation of viral antigens to T lymphocytes. In return, activated T lymphocytes produce more cytokines that induce the differentiation of monocytes into macrophages. Although the virus causes an immune response, it is ineffective, does not eliminate the virus or infected cells from the body. Epidemiological characteristics: receptive species, sheep, goats, mouflons, alpine goats, and black goats. Epidemiological characteristics. Risk factors. Race. Relatively sensitive, Texel, Border Leicester and Finnish landrace. Relatively resistant, Colombia, Rambouillet and Suffolk, co-infections, with lung adenocarcinoma virus, gives increased titer of MVV in the lung. Causal agent: there are distinct strains in sheep, goats and wild ruminants. Farming conditions will favorize transmission by cohabitation. Sources of infection: infected animals, with or without clinical signs. Modes of infection: vertical, respiratory, close and long-term cohabitation. Digestive: frequent consumption of colostrum and milk and rarely through contaminated water and food. Horizontal, intrauterine transmission is considered negligible or minor. Enzootic epidemiological dynamics. Clinical incubation: Maedi, respiratory, 2 to 3 years. Clinical signs most often at the age of 3 to 4 years. Visna, neural, 2 years. Clinical signs most often at the age of 2 years. Asymptomatic, the common form of evolution at MVV. Chronic MEDI, respiratory, more common in sheep. Visna, neuronal, more common in goats. MEDI form, respiratory, progressive loss of maintenance until emaciation, progressive dyspnea, sometimes dry cough. Rarely fever, bronchial exudate and depression. Death, 3 to 10 months, after the appearance of clinical signs, following anoxia, or secondary bacterial pneumonia. Visna form, nervous, insidious onset, with discrete nervous signs, instability on the hindquarters, trembling of the lips, tilt of the head, accompanied by loss of general condition. Progressive evolution towards ataxia, incoordination, muscle tremor, hypermetria, tremor facial muscles, paresis and paralysis. Rarely blindness. Death by starvation. Death occurs less than a year after onset clinical signs. MVV also produce progressive arthritis, slow evolution, severe lameness. MVV produce chronic indurative mastitis, decreased milk production, milk seems normal, decrease in average daily increase of lambs, probably due to reduced milk production. Lesions. Macroscopic. MEDI, respiratory. Injuries are limited to the thoracic cavity. Lungs are enlarged, abnormally firm and heavy, 2 kilograms, uniformly marbled or discolored appearance, areas of consolidation, the color of which varies from light gray to light brown. Abundant foamy liquid in the bronchi, areas of pulmonary emphysema. Small nodular formations, found around blood vessels and bronchioles. Lane mediastinal tissues are enlarged and edematous. In the early stages of the disease, the mottled appearance of the lungs may be subtle. Secondary bacterial pneumonia can hide the lesions caused by MVV. Macroscopic. Visna, nervous. The macroscopic lesions are not significant. White cloud-like spots in the meninges. Asymmetrical brown foci in the white matter of the CNS, brain and spinal cord, and on the ventricular surfaces swelling of the spinal cord. In advanced forms, emaciated or cachectic appearance of the carcass. Macroscopic. In sheep affected by indurative mastitis, the mammary gland is hardened. Lane enlarged retromammary. In some animals, we can still see arthritis and nephritis. Microscopic, MEDI, respiratory. Photo 1. Sheep, the lung fails to deflate, with pale gray coalescing proliferative areas, and cranioventral atelectasis, reddish area. Photo 2. Typical lymphoid follicle-like structures with germinal centers, diffuse thickening of alveolar walls, and smooth muscle hyperplasia, arrow, in terminal bronchioles and alveolar ducts. Photo 3. Advanced lesions of the MEDI, secondary bronchopneumonia, suppurative exudate in the respiratory tract, obliterates the pulmonary architecture. Interstitial pneumonia, infiltration of lymphocytes into the interalveolar space. Lymphoid hyperplasia. Hyperplasia of smooth muscles of the alveolar walls. Microscopic Visna, nervous, multifocal mononuclear inflammatory leukoencephalomyelitis, demyelination, mononuclear infiltrate, indurative mastitis, mononuclear infiltrate in the periductile stroma, normal obliteration of breast tissue. In some cases, vasculitis can be seen in the kidneys. Differential diagnosis. MEDI, respiratory, pulmonary adenomatosis, parasitic pneumonia, caseous lymphadenitis with pulmonary involvement, pseudotuberculosis caused by Corynebacterium pseudotuberculosis, chronic bacterial pneumonia, goat arthritis-encephalitis, melioidosis, Visna, nervous, scrapie, listeriosis, rage, louping eel, parasitism of the central nervous system, or Jeski's disease, trauma that causes compression of the CNS. Confirmation diagnosis. Correlation of serological results with the current clinical picture and the history of the disease in the territory. Suspicion: animals at least 2 years old that manifest respiratory syndrome with pulmonary disorders, progressive and slow breathing, nervous syndrome, enduring mastitis, arthritis, correlation of serological tests, clinical signs, and morphological examination. Confirmation diagnosis: viral isolation, viral nucleic acid detection, viral antigen detection, serological examinations for antibodies, histopathological examination, pathological material. For viral isolation or PCR. From live animals, blood on EDTA or heparin and milk. From the corpse, MEDI suspicion, lungs, lane mediastinals, spleen in phosphate buffered saline, and bronchoalveolar lavage, to harvest alveolar macrophages. Visna suspicion, brain, in phosphate buffered saline. For viral isolation, biological samples should be as fresh as possible histopathologically, organ removal with lesion, lung, lymph nodes, brain, spinal cord, kidneys and/or mammary gland. Highlight immunological restructuring, blood serum or milk from animals showing clinical signs. Viral isolation. Insulating substrate. Culture of leukocytes from peripheral blood or milk with sheep choroid plexus, SPC, cell cultures, sheepskin fibroblasts or other corresponding cell lines. Identification of the causal agent. Highlight MVV in cultures. In co-cultures identifies the cytopathic effect. The presence of the virus can be confirmed by immunological antigen detection methods and by electron microscopy. Adherent macrophage cultures, obtained from postmortem bronchoalveolar lavage, can be tested for virus production by electron microscopy or PCR. They can also be co-cultured with indicator cells for viral isolation. Nucleic acid detection techniques, polymerase chain reaction, PCR, Western blot and in situ hybridization. Immunological diagnosis. Immunodiffusion in agar, IDG agide, ELISA. Western blotting, in specialized laboratories, when the serological results are not conclusive. Radioimmunoprecipitation and radioimmunodiagnostics for research only. Interpretation. Great value in herd-level screening activity. In adult sheep and goats, positive test will show persistent MVV infection. Most animals do not show clinical signs, but the presence of clinical signs in seropositive AB animals does not confirm the presence of MEDI Visna. Histopathological examination. In seropositive animals, presenting clinical manifestations, the diagnosis must be confirmed histopathologically, aggregates of lymphocytes, macrophages and perivascular plasma cells. In all cases, the inflammatory areas are surrounded by areas intensely populated with astrocytes and microglia. Demyelination of axons adjacent to the inflammatory focus is observed. Histochemical immune staining with monoclonal antibodies is another method used. Prophylaxis. Managerial practices can influence the prevalence of infection, and therefore the frequency of the disease. MVV is often introduced into the herd through the purchase of animals. Purchase of animals is only made from farms free from MVV, or only after quarantine and serological tests. Uninfected herds should be kept separate from seropositive or untested herds. Goats may be involved in the transmission of viruses from the small ruminant lentivirus serogroup to sheep. Immunoprophylaxis. No vaccine is available at this time. Combat. There is no specific treatment. If the virus is introduced into a previously free country, requires effective elimination. MVV can be eradicated from a herd, or its prevalence reduced by permanent isolation of lambs from their mothers immediately after birth. Feed lambs uninfected colostrum, pasteurized milk, milk substitutes, or milk from MVV-negative sheep. Periodic serological testing and separation of seronegative and seropositive sheep. MVV-positive sheep must be slaughtered. Some of these viruses encountered in animals could play a zoonotic role. These are mainly rotaviruses. Rotaviruses identified in many animal species are generally specific to the host species, but zoonotic transmission is suggested, either due to the observation of cases of cross-contamination, in particular by experimental reproductions, or by comparison of sequences. Genetics showing the existence of a close relationship between certain animal and human rotaviruses, or even after the discovery, during epidemiological surveillance, of human rotaviruses, new genotypes which turn out to be of animal origin. Rotavirus is the most common viral cause of diarrhea in young goats and lambs. Group A and B rotaviruses are involved, but Group A is the most widespread and clinically important, and contains several serotypes with different virulence. Rotavirus replicates in mature absorbing and enzyme-producing enterocytes on the villi of the small intestine, leading to rupture and sloughing of the enterocytes, with release of the virus and infection of adjacent cells. Rotavirus does not infect immature crypt cells. With virulent strains of rotavirus, the loss of enterocytes exceeds the capacity of intestinal crypts to replace them. Consequently, villus height is reduced, with a consequent reduction in intestinal absorption surface area, and in the activity of intestinal digestive enzymes. The coronavirus, commonly associated with diarrhea, replicates in the epithelium of the upper respiratory tract, and in the enterocytes of the intestine, where it produces lesions similar to rotavirus, but also infects the epithelial cells of the large intestine, to produce an atrophy of the colonic ridges. Diarrhea in lambs is a complex, multifactorial disease including animal susceptibility, nutritional status, environmental factors, and a variety of infectious agents. The four main infectious causes of diarrhea in lambs during the first month of life are Escherichia coli, rotaviruses VR, Cryptosporidium sp. and Salmonella sp. Sheep RVs belong to either RVA or RVB, but the epidemiology of RVs in lambs is still largely unknown. Several studies have shown high morbidity, 75 to 100%, during outbreaks of neonatal diarrhea with remarkable mortality. In these studies, RVB was detected in 16 to 100% of stool samples, examined from diarrheal and non-diarrheal lambs. A study conducted at the U.S. Sheep Experiment Station showed that diarrhea accounted for 46% of lamb mortality. The occurrence of ovine RVA has been reported in various countries around the world, and depending on the epidemiological context, the diagnostic test used. Limited information is available on the genotypes of ovine rotavirus RV strains globally. The largest dataset was released from India, where 500 samples collected over a period of 3 years were tested for RVs with a combination of antigen detection and molecular methods, and subsequently 52 strains were genotyped for the VP7 and VP4 genes. Among the 52 strains, the most common genotype was G6, 48%, followed by G10, 36%, and most strains had APVP4 gene. At least 3 ovine RVA strains have been characterized in China, and G10 was the only antigenic combination observed, LP14, LAM-NT, CC0812. The entire genomes of 2 of these strains, LAM-NT and CC0812, have been sequenced, revealing conserved configurations of backbone genes. In Europe, a large serological survey conducted in Spain identified neutralizing antibodies against 7 serotypes G in sheep sera, with the highest titers and prevalence against serotypes G10, G3 and G6. In a Spanish strain characterization study, a single ovine RVA from an outbreak in 50 to 60-day-old lambs was genotyped as G8P. Another Spanish RVA strain typed G8. In the UK, 4 lamb RVA strains have been characterized, each with different specificities, such as LRV1, JEP, LRV2A, G6P, LRV2C, G9P and K923, G10P. Outbreaks of neonatal diarrhea in goats have essentially the same disease burden as described for sheep. Causes of diarrhea in goats include infectious agents including bacteria, viruses, parasites, as well as management practices. Caprine rotavirus RVs have been commonly involved in diarrhea in 2-3 days old lambs, and the identified Caprine RV strains were found to belong to RVA, RVB or RVC. The most commonly identified other microorganisms causing diarrhea in goats during the first month of life are E. coli, Cryptosporidium, and Salmonella. The presence of Caprine RVA and RVB has been reported in various countries around the world. In a study conducted in Italy, researchers reported an approximately 60% detection rate of RVA in samples from diarrheal goats, whereas in a Spanish study, RVA was detected in half of stool samples from goat examined. Other studies from Spain also reported RVB-associated diarrhea in kids with moderate morbidity, 22.6%, and no mortality. RVB was detected in 71%, 5 of 7, of samples examined in diarrheal goats, but could also be detected in non-diarrheal goats. Microbiological examination showed that these samples were negative for Cryptosporidium parvum, Clostridium perfringens and E. coli. Munoz et al. Found a lower prevalence of RVA in diarrheic goats, 13.5%, and reported RVA in 8% of samples. The main causes and risk factors of diarrhea in the first week are involved bacteria, coli, salmonella, and Clostridia like C. perfringens, parasitic pathogens, Cryptosporidia, and viral rotaviruses. Finally, dietary causes, such as excess nitrogen, are not known. In the second week, even bacteria are involved, salmonella, and Clostridia like C. perfringens, parasitic pathogens, Cryptosporidia, viral rotaviruses, and food causes, excess nitrogen. After 3 weeks of life are involved, bacteria, salmonella, and Clostridia, parasitic pathogens, Strongyles, Coccidia, Cryptosporidia, viral rotavirus, and dietary causes, excess nitrogen, acidosis and deficiencies. Risk factors are linked to immune status, such as stress and poor colostrum intake, the presence and exposure to pathogens, water, soiled litter, and high animal density. Factors linked to the development of pathogens such as temperature and humidity. Prophylactic actions target actions on the herd, such as compliance with immunoprophylaxis programs and their adaptation to the epidemiological situation of the herd. Chemoprevention if necessary. Respect for colostrum period, necessary to allow the transfer of immunity from ewes to lambs. Administration of selenium and vitamin E supplements in the diet of sheep. Actions on shelters to ensure biosecurity and cleanliness, reduce humidity and ensure effective ventilation. PESTE petite ruminants, PPR, is an acute contagious disease caused by the small ruminant morbillivirus in the family Paramyxoviridae. It affects mainly sheep and goats and occasionally wild small ruminants. Based on the fact that PPR has been reported on a few occasions in camels, cattle and buffaloes, those animal species are considered to be susceptible, although their potential role in the circulation of PPR virus has not been formally established. PPR occurs in Africa except southern Africa, in the Arabian Peninsula, throughout most of the Near East and Middle East, and in Central and Southeast Asia. The clinical disease resembles rinderpest in cattle. It is usually acute and characterized by pyrexia, serous ocular and nasal discharges, diarrhea and pneumonia, and erosive lesions on different mucous membranes, particularly in the mouth. At necropsy, erosions may be noted in the gastrointestinal and urogenital tracts. The lungs may show interstitial bronchopneumonia and often secondary bacterial pneumonia. PPR can also occur in subclinical form. Etiology. On the basis of its similarities to rinderpest, canine distemper and measles viruses, the virus causing PPR has been classified within the genus Morbillivirus in the family Paramyxoviridae. It is now officially named small ruminant morbillivirus. Pending further revision of this chapter, it is also referred to below as PPR virus, PPRV. Virus members of this group have 6 structural proteins: the nucleocapsid protein, N, which encapsulates the viral genomic RNA, the phosphoprotein, P, which associates with the polymerase, alpha large protein, the matrix, M, protein, the fusion, F, protein, and the hemagglutinin, H, protein. The matrix protein, intimately associated with the internal face of the viral envelope, makes a link between the nucleocapsid and the virus external glycoproteins, H and F, which are responsible, respectively, for the attachment and the penetration of the virus into the cell to be infected. The PPRV genome also encodes 2 non-structural proteins, C and V. Epidemiology. PPR was first described in Côte d'Ivoire. Since the late 1990s, it has expanded its range to cover large regions of Africa, from North Africa to Tanzania, and the Middle East, and is also widespread in countries from Central Asia to South and East Asia. The natural disease affects mainly goats and sheep. It is generally considered that cattle are only naturally infected subclinically, although in the 1950s, disease and death were recorded in calves experimentally infected with pre-infected tissue, and PPRV was isolated from an outbreak of rinderpest-like disease in buffaloes in India in 1995. Antibodies to PPRV as well as PPRV antigen and nucleic acid were detected in some samples from an epizootic disease that affected dromedaries in Ethiopia and Sudan. PPR affects a number of wild species within the order Artiodactyla, some of which species are highly endangered, e.g., the Mongolian saiga antelope. The American white-tailed deer, Odocoileus virginianus, can be infected experimentally with PPRV. Dual infections can occur with other viruses such as pestivirus or goatpox virus. Clinical. The incubation period is typically 4 to 6 days, but may range between 3 and 10 days. The clinical disease is acute, with a pyrexia up to 41 degrees Celsius that can last for 3 to 5 days. The animals become depressed, anorexic, and develop a dry muzzle. Serous oculo-nasal discharges become progressively mucopurulent and, if death does not ensue, persist for around 14 days. Within 4 days of the onset of fever, the gums become hyperemic, and erosive lesions develop in the oral cavity with excessive salivation. These lesions may become necrotic. A watery blood-stained diarrhea is common in the later stage. Pneumonia, coughing, pleural rales, and abdominal breathing also occur. The morbidity rate can be up to 100% with very high case fatality in severe cases. However, morbidity and mortality may be much lower in milder outbreaks, and the disease may be overlooked. A tentative diagnosis of PPR can be made on clinical signs, but this diagnosis is considered provisional until laboratory confirmation is made for differential diagnosis with other diseases with similar signs. Lesions. At necropsy, the lesions are very similar to those observed in cattle affected with rinderpest, except that prominent crusty scabs along the outer lips and severe interstitial pneumonia frequently occur with PPR. Erosive lesions may extend from the mouth to the reticulorum junction. Characteristic linear red areas of congestion or hemorrhages may occur along the longitudinal mucosal folds of the large intestine and rectum, zebra stripes, but they are not a consistent finding. Erosive or hemorrhagic enteritis is usually present and the ileocecal junction is commonly involved. Pious patches may be necrotic. Lymph nodes are enlarged, and the spleen and liver may show necrotic lesions. Diagnostic. Samples for virus isolation must be kept chilled in transit to the laboratory. In live animals, swabs are made of the conjunctival discharges or from the nasal, buccal or rectal mucosa. During the very early stage of the disease, whole blood is also collected in anticoagulant for virus isolation, polymerase chain reaction, PCR, and hematology. Either ethylene diamine tetraacetic acid or heparin can be used as anticoagulant, though the former is preferred for samples that will be tested using PCR. At necropsy, samples from 2 to 3 animals should be collected aseptically from lymph nodes, especially the mesenteric and bronchial nodes, lungs, spleen and intestinal mucosae, chilled on ice and transported under refrigeration. Samples of organs collected for histopathology are placed in 10% neutral buffered formalin. It is good practice to collect blood for serological diagnosis at all stages, but particularly later in the outbreak. Diagnostic. Immunocapture enzyme-linked immunosorbent assay. IC ELISA, using 2 monoclonal antibodies, MAB, raised to the N protein allows rapid identification of PPRV. Quantitative real-time RT-PCR. In recent years, nucleic acid amplification methods for PPR diagnosis have been significantly improved with quantitative real-time RT-PCR. This method is also 10 times more sensitive than conventional RT-PCR, as well as minimizing the risk of contamination. A real-time RT-PCR assay specific for lineage 4 strains has also been described. An alternative to RT-PCR is loop-mediated isothermal amplification. Culture and isolation methods. Even when diagnosis has been carried out by rapid techniques, the virus should always be isolated from field samples in tissue culture for further studies. PPRV may be isolated in primary lamb kidney/lung cells and some cell lines, Vera, B95A. Unfortunately, PPRV isolation using such cells is not always successful on first passage and may require multiple blind passages. Recently, derivatives of cell lines, Vera, CV1, expressing the morbillivirus receptor, the signaling lymphocyte activation molecule, SLAM or CD150, have been developed that enable isolation of field viruses from pathological specimens in less than 1 week, without requirement for blind passages. Agar gel immunodiffusion. AGID is a very simple and inexpensive test that can be performed in any laboratory and even in the field. Standard PPRV antigen is prepared from infected mesenteric or bronchial lymph nodes, spleen or lung material and ground up as 1/3 suspensions, WV, in buffered saline. Virus neutralization. This test is sensitive and specific, but it is time-consuming. The standard neutralization test is now usually carried out in 96 well microtiter plates, although roller tube cultures may also be used. Vera cells are preferred, but primary lamb kidney cells may also be used. Competitive enzyme-linked immunosorbent assay. Several competitive ELISAs, see ELISA, have been described, based on the use of mAbs that recognize virus proteins. Advice on the use and applicability of ELISA methods is available from the WO reference laboratories for PPR. Some methods are available as commercial kits. These are the only practicable way to carry out this test. Before use, laboratories should seek assurance that the kit has been validated in accordance with the WO validation standard. Combat and prophylaxis. Establishment of a containment zone within a PPR-free country or zone. In the event of limited outbreaks within a PPR-free country or zone, including within a protection zone, a single containment zone, which includes all cases, can be established for the purposes of minimizing the impact on the entire country or zone. For this to be achieved and for the member country to take full advantage of this process, the veterinary authority should submit documented evidence as soon as possible to WO that the outbreaks are limited based on the following factors. Immediately on suspicion, a rapid response including notification has been made. Standstill of animal movements has been imposed, and effective controls on the movement of other commodities mentioned in this chapter are in place. Epidemiological investigation, trace back, trace forward, has been completed. The infection has been confirmed. The primary outbreak has been identified, and investigations on the likely source of the outbreak have been carried out. All cases have been shown to be epidemiologically linked. No new cases have been found in the containment zone with a minimum of 2 incubation periods of 21 days after the stamping out of the last detected case is completed. A stamping out policy has been applied. The susceptible animal population within the containment zones is clearly identifiable as belonging to the containment zone. Increased passive and targeted surveillance in the rest of the country or zone has not detected any evidence of infection. Animal health measures that effectively prevent the spread of the PPRV to the rest of the country or zone, taking into consideration physical and geographical barriers, are in place. Ongoing surveillance is in place in the containment zone. The free status of the areas outside the containment zone is suspended while the containment zone is being established. The free status of these areas may be reinstated once the containment zone is clearly established, by complying with points 1 to 6 above. It should be demonstrated that commodities for international trade have originated outside the containment zone. Recovery of free status. Should an outbreak of PPR occur in a previously free country or zone, its status may be recovered 6 months after the disinfection of the last affected establishment, provided that a stamping out policy has been implemented. Surveillance has been carried out with negative results. The PPR-free status of the country or zone will be reinstated only after the submitted evidence has been accepted by WO. Vaccination. Sheep and goats vaccinated with an attenuated strain of PPR or that recover from PPR develop an active lifelong immunity against the disease. Several PPR vaccines are available, all of which are cell culture attenuated strains of natural PPRV. The two most commonly used vaccine strains, Nigeria/75/1 and Sungri/96, have both been shown in experimental trials to protect animals against PPRV isolates of all lineages, Hodgson et al., 2018. The Nigeria/75/1 vaccine has also been proven to provide such complete cross-lineage protection in field use in a large number of countries.